Yeah.
It's really something how much health information is out there now. Almost overwhelming, isn't it?
Totally. You hear about one thing, read another, and suddenly you're picturing the worst.
Exactly. And well, imagine that feeling, but ramped up because maybe you're in a conflict zone or somewhere you just can't easily see a doctor. The fear must be immense.
Oh, absolutely. When resources are tight and things are already stressful, even a small health worry can become, well, huge. That not knowing what to do next, it's really unsettling.
Well, that's precisely what we're digging into today. We've got some really interesting material here, parts of a PDF about something called Dr. Maya GPT, and another one about how they train people to use it.
Mm-hmm.
So our mission really is to explore how this AI tool could potentially make a difference in those kinds of tough situations,
Wow.
like helping soldiers manage health fears, maybe cutting down on unnecessary trips back to base.
And even helping manage minor injuries with the tech they might have available, like radio.
Yeah, exactly. Using technology smartly.
And the sources suggest it's designed specifically for that accessibility, practical use, even when things like internet might be patchy. It's about taking complex medical stuff and making it, well, usable for anyone, which is quite a concept.
Okay, so diving in, this Dr. Maya GPT document,
Yeah.
it jumps right into this idea of fear being a big driver in healthcare choices.
Right.
It describes this kind of cycle.
Yeah.
Minor symptom, then worry, maybe unnecessary trips to the doctor, tests, waiting,
Yeah.
which costs money and just ramps up the anxiety.
And it makes a key point that anxiety triggers cortisol,
Ah, yeah?
which, can actually suppress your immune system. So the fear itself makes things potentially worse. It feeds itself.
Wow. And the document connects to that individual feeling to bigger problems, doesn't it? Like healthcare costs spiraling or even preventable infections spreading because maybe people delay getting the right advice or they
Yes.
panic.
It does. That initial fear, even if it turns out to be nothing serious, puts a strain on the whole system. And think about that in the context we mentioned, soldiers, remote communities.
Wow.
The impact of that fear and the difficulty getting help, it's magnified massively.
Right. So enter Dr. Maya GPT. The source calls it this innovative digital health assistant, a sort of co-creation between Dr. Kadiyali Srivatsa and ChatGPT.
Mm-hmm.
And the core philosophy seems to be putting the person, the patient, back in control, empowering them.
A key part of that is this very simple color-coded system for symptoms they describe. Red, yellow, green, and blue. Can you break those down for us?
Sure. It's designed to be instantly clear. Red basically means emergency, get proper medical help now.
Okay, urgent.
Yellow is more like, unclear, keep an eye on it, see if it changes, act then.
Watch and wait, essentially.
Green suggests it's probably minor. Maybe talk to a pharmacist or a nurse, something manageable.
Right.
And blue is specifically for when you suspect an infection. The main advice there is isolate. Stop the spread.
That's interesting. So it's not just about symptoms, but immediate actions.
Exactly. The source says this isn't just for clarity. It's actually designed to, interrupt that anxiety response you mentioned. Instead of spinning out with what ifs.
To get an immediate category, an action.
Yeah, it sort of bypasses the panic, the cortisol surge, hopefully.
And avoids potentially unnecessary trips or treatments based purely on that initial fear.
Makes sense. So it acts like that first point of contact. The PDF uses the phrase, intercept this fear before it manifests. It aims for a calmer, more solution-focused mindset. You feel like you can do something, not just worry.
Uh-huh. And the vision described, it goes pretty deep. It talks about moving away from dependency and panic towards self-healing and conscious intervention.
Yeah, they even mentioned reprogramming the collective subconscious to believe in self-healing. That's ambitious. And this term universal entanglement, what's that about in this context? How does it link to self-healing?
Well, universal entanglement suggests this idea of deep interconnectedness. Maybe that our own ability to heal is connected to others, to the universe, in ways we don't fully grasp.
Right.
In the context of Dr. Maya GPT, it seems to reflect a belief in the body's inherent power to heal itself if it gets the right signals and support, moving away from needing constant outside fixes.
I see.
But practically speaking, it really comes back to that immediate color-coded advice. That's the thing that helps someone shift from feeling anxious to feeling informed and ready to act.
Right, so let's explore that more, how it tackles the fear of illness, of infections. That color system, it cuts through the uncertainty, doesn't it?
It seems designed to.
Like the itchy rash example they give. Instead of immediately thinking the worst, the user inputs symptoms, maybe even just speaks them. like the training program suggests.
Voice input is key there.
And they get a color. If it's green or yellow, maybe this suggests an antihistamine or just watching it. That immediate guidance could really dial down the panic, right?
Absolutely. That initial fear of the unknown gets replaced with a concrete suggestion. And the blue code for infections is really crucial too.
Yeah, tell me more about that.
It directly tackles the spread. It's not just how do I feel, but also how do I protect others. That instruction to isolate is simple, actionable public health advice built right in.
And the training program PDF, it sounds like it focuses heavily on making these skills practical and immediate, not just theory.
Exactly. The training is about using the tool right away, applying the color codes in real scenarios. It's meant for immediate use.
Okay, let's pivot to a specific high-stress scenario.
Yeah.
Soldiers on a front line. Maybe think about the Indo-Pakistan conflict context mentioned. Access to doctors is obviously limited, stress is through the roof. How could Dr. Maya GPT actually help there?
Well, in that kind of environment, getting fast, reliable health info is critical. Could be life or death, potentially. The training program's focus on voice interaction is key here. A soldier could just describe symptoms their own, or a buddy's, and get an initial assessment from the AI. The training modules actually have people practicing this speaking symptoms into the device.
And that color code.
Yeah.
It means they wouldn't need a medical degree to understand the basics of the situation in those first crucial moments.
Precisely. A red code for a bad wound signals, get this person evacuated now, if that's even possible.
Yeah.
A yellow might mean, okay, let's do some basic first aid, keep a close watch. A green could be reassurance, this isn't critical right now, manage it with basic supplies.
That immediate feedback, that sense of knowing something, must reduce the fear and anxiety in such a volatile place. Gives a bit of control back.
That sense of agency, yeah, when everything else feels out of control.
And thinking about logistics, could it help reduce wasted transfers back to a base hospital?
That seems like a major potential benefit. Think about it. Soldier has a minor complaint. Normally, maybe they get sent back just to be safe. Risky transfer uses up resources.
Right.
But if Dr. Maya GPT gives a green code, suggests simple care or monitoring that can be done right there,
You avoid that whole unnecessary transfer.
potentially, yes. It acts as a triage tool, sorting the minor from the major. And Module 4 in that training PDF, it specifically has users practice asking the AI about symptoms and then dictating messages based on the result. That clearly points to a workflow. Assess with AI, then communicate clearly if a transfer is actually needed. Saves resources for the serious cases.
Okay, this next bit is interesting. Managing minor injuries using internet tech by doctors using radio-visual technology. How does that fit together?
So Dr. Maya GPT provides the initial assessment, that color code. That's step 1.
Yep.
Even if internet is bad, that basic info, the color code, maybe a brief symptom description could be relayed via radio by the soldier using the AI.
So the remote doctor gets an instant snapshot.
Exactly, a standardized starting point. Now add radio-visual tech. Maybe it allows sending a quick image or even just a clearer description guided by the doctor.
Ah, I see.
So the doctor, miles away, gets the green code, minor abrasion message via radio, maybe sees a quick visual. They can then ask targeted questions back via radio. Is it bleeding? Any swelling? And potentially guide the soldier on the ground through cleaning and dressing the wound remotely.
Preventing an evacuation for something manageable on the spot.
Precisely. The AI provides that first, simple, understandable assessment that makes the whole remote consultation much more feasible and effective, even with limited tech.
So let's pull back. If, say, the Ministry of Defense, the Army, decided to roll this out, what are the big wins for the organization and for the soldiers themselves?
Well, several big ones, I think. First, definitely easing the load on medical resources. Better triage, fewer unnecessary transfers. That means saving money and keeping resources free for critical needs. Cost-effective healthcare, basically.
Makes sense.
Second, and maybe just as important, is soldier morale. Giving them a tool, reducing that fear of the unknown when it comes to health issues. That empowerment is huge.
That feeling of having some kind of immediate guidance must be invaluable.
Absolutely. Then there's the speed of initial assessment. In combat, time is critical. Getting that instant color code gives immediate insight.
Standardized information too, right? Everyone gets consistent advice initially.
Yes, reliable, consistent advice. Plus, as the PDF mentions, it boosts readiness for things like outbreaks or pandemics. That blue code for isolation is built in.
And it's global, works across barriers.
Exactly. Bridges the gap for remote units. But fundamentally, it comes back to empowerment.
Yeah.
Shifting control back to the soldiers, reducing dependence and panic.
And it uses tech soldiers likely already have access to or could easily get, like smartphones or tablets.
Right, like the training program mentions. And the training itself, being visual using voice, it's designed to be simple even for those with limited literacy.
It really does sound like more than just another health app. It feels like a tool for resilience, for empowerment, particularly when things are toughest.
That seems to be the core idea, yes. Moving from reacting out of fear to acting with information. A proactive approach.
So, wrapping up this deep dive,
Yeah.
it really gets you thinking, doesn't it? How AI tools like Dr. Maya GPT could genuinely change the game for healthcare access and how decisions get made, especially in these critical, often underserved situations. It pushes past the old limitations, and it makes you wonder, what are the wider implications, not just for one soldier's well-being, but for managing health resources and tackling challenges on a much bigger scale,
Yeah.
something to really chew on.